We wouldn't tolerate this in any other profession.
Vancouver Coastal Health has confirmed a healthcare provider was assaulted by a patient on Thursday and is now at home recovering from their injuries. The VPD has arrested the patient following the attack. According to the BC Nurses Union, the victim was a student nurse who was in their first clinical placement here at VGH, where they were struck with a knife and suffered puncture wounds, which required immediate medical attention.
We're certainly very concerned that violence and incidents with weapons, in particularly, is on the rise.
The president of the BCNU says the increase in workplace violence is making it hard to retain nurses, regardless of the 320 relational security officers she says are put in place in some hospitals across BC.
Any given time in this province, we are 6,000 nurses short. And if nurses don't feel safe, I would boldly say that patients likely aren't safe either.
In a statement, the BC Ministry of Health says in part, health authorities have policies in place prohibiting weapons and drugs in hospitals, and they will continue working to review policies. Gear says the policies are not properly enforced, as weapons are still getting through hospital doors. Earlier this year, the union surveyed members in the Vancouver Coastal region.
39% report being exposed to weapons at least monthly.
Gear is calling on WorkSafe BC and the Provincial Health Authority to address safety concerns in hospital settings, as well as a push to install metal detectors at hospital entrances.
Double duty, being a security officer on top of being a nurse, is just not a reasonable expectation.
City News reached out to WorkSafe BC, but did not hear back in time for broadcast deadline. In Vancouver, Angela Bowers, City News.